So welcome to Taking Charge of My Cancer podcast, episode 14. I am Derly Munoz, your host, and I'm really happy to have a very special guest today, Dr. Kerry D'Ambrogio. Kerry is a physical therapist, osteopath, and a board-certified acupuncture physician. He is the author of Positional Release Therapy, Mosby, and his published articles has been featured in physical, occupational, and massage therapy magazines. Dr. Ambrogio started lecturing in 1988 and has taught over 20 countries worldwide. He's a certified instructor recognized by the Upledger Institute, the Barral Institute, and the International Alliance of Healthcare Educators. He founded the Ambrogio Institute with the vision of providing a comprehensive osteopath manual therapy curriculum to train clinicians to make better decisions regarding their patient care. So, Kerry, welcome to my podcast, and it's a pleasure to have you in here today.
Thank you for having me.
Absolutely.
I like the way you said my last name. You said a little Spanish flair.
Okay, tell me what is the Canadian.
Oh, it's good. I always just say D'Ambrogio, but you just said it elegantly.
Okay. Yeah, no, I like that. I like that. So I was actually going to ask you, it's like, I'm saying this right, but no, it has to have my accent, right?
Oh, yeah, no, it's fine.
So tell me, how do you end up in all these multiple amount of titles that you have? How do you end up on your mission here?
Well, I'm from Canada originally, and I'm in Sarasota, Florida. And it all, my mission is basically to help, young manual therapists, probably, like myself when I started out in the first 10 years, because you're under a lot of pressure. You're under a lot of pressure, from whoever hired you. The patients are depending upon you. And, a lot of times there's different clinicians, different ages, different level of experience. So, you're always got eyes on you to do it right. And as manual therapists or anything, we always have the same things that we do. We're always trying to figure out when a patient comes to us with a problem, could be a knee problem, a shoulder problem, cancer, whatever, is where do we treat? Do we treat the site that they're complaining of, or do we treat somewhere else? And once we decide where it is we're going to treat, what do we treat? All right. And then, how do we progress from that? So it's been my mission to teach for many years, these different things, all the different courses that I teach. But because of COVID, it's all kind of gone away from, every weekend going to a different city, different country, to now teaching online. So my goal now is to harness all these courses together, make them very clear, and kind of offer them on a, online format so that, I can serve more people, in, different countries. And also because of all this, I can answer their questions. A lot of times I was thinking about this, I would go to Chicago, teach a class, and then I would leave and I wouldn't be back to Chicago for a year because I'm going to all these other places. And there's no way for me to follow up or make sure people are doing things correctly. So I really love this opportunity to to really train these therapists into making better clinical decisions.
Awesome, perfect. So what were you first? Were you a physical therapist and then osteopath, or?
Actually, I was a football player. I went to college to play American, not your football from South America. Uh-huh. So American football, I was an inside linebacker, and I had lots of injuries, concussions, knee injuries, shoulder injuries. And I remember that when they would take me to the athletic therapy clinic, they would just treat the site of my pain, whether it be my knee, my shoulder, whatever. And I felt they didn't really look at my whole body, and I just accumulated lots of problems. And so I knew kind of my days as a football player were numbered. So the first thing I did was become an athletic trainer. Mm-hmm. And I basically treated my patients the same way they treated me. Ice cold whirlpool tanks, modalities, exercise, things like that. And then I went to PT school. I'm from Canada, so I was University of Toronto. And then after that, I went to acupuncture school and then osteopathic school. So that was kind of like the order.
Okay, gotcha.
Taking all these things.
So if you have 3 valuable tips for our oncology patients that you can have from your journey, what that can be?
For your patients?
Yeah.
Let's see. I really, and it's a tough thing to say, but as I go through life, I really believe that life happens for us, not to us. Things happen along the way, whether it's, cancer, surgery, falls. And we all have, I mean, my wife had breast cancer. I told you about that. And we went through all that, and my father-in-law, all different things. And she responded very well to it. We grew as a couple from it. And I grew because I understood, I had to pull in my doctor of Oriental medicine, but my osteopathic hat. We looked at nutrition. She had a double mastectomy. And as a woman, it's very difficult when you go through that. And I think all of that brought us closer together. Mm-hmm. So as bad as it was, mm-hmm. There's some good things with it, because we got to be closer together and grow from it. And it's our journey, and everybody has a journey. Mm-hmm. And I think that there's lots of bumps along the road, and hopefully if you have the cancer, you seek the treatment. There's lots of options. I'm into obviously a lot of alternative in conjunction. She had alternative and also Western medicine. So that's the first thing that I would have in my mind. Anytime something bad happens, I'm always saying, okay, what I always say inside I got this from someone, but inside my brain, I go, okay, I got this. I look at it as almost another challenge in my life mm-hmm. that I have to face. And when I do it, it takes away a lot of the stress. Then I focus on my wife, or I focus on the situation. Okay, how can we make this better? Mm-hmm. Even with COVID, mm-hmm. COVID, it was, a terrible thing. People lost jobs, they couldn't work, this and that. I stopped teaching live because of that, because we couldn't do it. But you know what? It was like one of the best things that ever happened to me, because mm-hmm. I actually reconnected with all my kids. My wife and we reconnected even more. And then, now I'm doing this online thing. So I think these things just push us along through life as challenges. Yep. So I kind of look at it. And the other thing I would say is live a life of purpose. There's my mentor, one of my mentors, John Wernham. He was 99 years old. He was an osteopath from England. And he was still treating 8 patients a day at age 99. Wow.
That's awesome.
Yeah, he died in his 100th year. And I have another patient who's 90. This guy's 90 years old, and I treat him online. And he writes children's books, but he's still learning. Mm-hmm. And I love when I look at these people, they're living a life of passion and meaning. Yep. And there was a book I like, Viktor Frankl, Man's Search of Meaning. And he talks about Nazi Germany and how he would study. He was a psychologist, and he would study those people that seemed to do well and those that didn't. And the ones that did well always had a reason for getting up and doing something. So I would say, change your mindset. Life is happening for you. How can, what can I learn from this? How can I move forwards? And, give yourself, meaning, a purpose. And also, when I used to work with Tony Robbins, he used to always say this thing, CANI, CANI, and it stood for constant and never-ending improvement.
I love that.
Yeah. So I always strive each day, each week, how can I get a little bit better, mm-hmm. With what I do? And, a lot of times we overestimate what we can do in a year, but we underestimate what we can do in 5 years. Mm-hmm. People get so inundated with stress. Oh, I got all this. No, just take it one step at a time. Then you realize 5 years later, wow, look how much I've done. So it's just moving that needle forward step by step and taking away the intensity of it and just living more for the meaning. And I think everybody's life has a purpose.
Mm-hmm. That's very well done. Something that you mentioned, 2 things that really remind me a couple of things. A few years ago, I used to live and work in Jacksonville doing orthopedics, and I just been doing oncology for the last 14 years of my 34-year career. Mm-hmm. And I remember this lady came in, the cutest thing on like a tennis attire. 90 years old. And she's like, honey, you got to get my back better because I have a tournament. She played doubles twice a week. And it's like, I'm one of their best players, and we have a big championship coming up in 3 weeks. You have 3 weeks to get me better. And I'm like, absolutely. And I look at her body, and she looks like, oh my God, she was like 70 years old, like maybe early 70s. And when she told me the age, I couldn't believe it. I have to ask her for her driver license because I just didn't know. And then she totally totally changed my mind about age has nothing to do with what you're capable to do, since you mentioned that. And the other thing is as well, has been a lot of like changes for me where I've been learning from my patients in oncology in the last 14 years of my career. Like, you see life in a completely different way. And I'm sure that happened to you and your wife. Like, those little things, like don't sweat the small stuff, those little things really doesn't matter. Like, what do I complain about? Because my neck hurts when you have these patients who go one after one treatment and terrible, for some secondary effects. So really, you just start seeing life in a different perspective. But that's what I really love to treat this kind of type of population, because it's really a different mindset. They're so grateful for everything happen every day in life, when we tend to be with our other population I used to treat, maybe not as much. So that's been a really nice learning path there. Great. How about your most painful lesson from your journey?
Let's see. The one I always talk about, because I talk about when I teach, is I told you when I was in college, I played football. And I can remember my first year of college football. I was a good high school player, and I was an all-star in that. And when I went to college, I probably had a chip on my shoulder, and I didn't think I had to, train as hard. I had a good, fun summer. And then I show up because I always, did well. But when you go to college, you're getting all the best players from high school. So I'm trying out and competing, and, I thought I was doing okay. But then all of a sudden, someone says, oh, coach wants to see you. Your name's on the list here. And I looked, and my name was there. And stupid me thought, oh, the coach is going to tell me I'm going to be starting, or, or this or that. But I was on the list to be cut from the team.
Oh, wow.
They were going to cut me from the team. And I go, what? And I've never been cut in my life before. And I didn't want to tell my mother, my father, my friends, nobody. I was so embarrassed, so ashamed. And I learned a lesson. I remember that there was we had several fields, and the team would be playing, and my mom thought I was still practicing and playing for the team. I never told them I got cut. So I would stay there, and I would weight train. I would run on the other field. I would sprint. I just kept training and training and training. And then that was at York University in Canada, in Toronto. And then I left the school that year, and I went to another school, which is where I wanted, where I always wanted to go, University of Western. University of Western is the #1 football team in the country.
Oh, wow.
I made that team.
Oh, wow.
And eventually became an all-star there. But it's because of the lesson I learned is always be prepared. Always be prepared. Like, anytime I go to teach, or it doesn't matter how big the venue is, I always organize in my head, okay, how can I serve? What can I tell these people? Because it's not about me, it's about them. And it really stuck me. I just, and that goes back to what I said earlier. Life happens for you, not to you, And I think that was a thing along the way that I had to go through. And it, I think it makes you a better person. It hurt like hell at the time. You have a young, 19, 20-year-old man, and you're getting cut. I mean, it's a blast to your whole ego in that, but I think it made me a better person, better player, definitely.
Awesome. That's perfect. Is anything that you have that will be of a value for our audience? And will you share it with us?
Let's see, a value. I would say the thing that I always preach, would these be for patients or for therapists?
You can do either way.
Okay. For me, we always have a tendency out there to treat whatever's screaming out. Remember, I told you I had all these different problems, instead of sitting back and looking at, the whole body, for example. When you let's say a person comes in with a knee problem, because I do a lot of orthopedics. And what happens is a lot of people pick their favorite form of treatment and they treat that knee. They want you to treat the knee. But ask yourself a better question. I always like to ask myself questions. How does a knee heal? Well, it needs blood supply, from the heart carrying oxygen nutrition. It needs energy supply, nerve supply. But in order for it to get it, you got to get rid of the toxicity, the venous return, lymphatic return, all of that. So you and I are manual therapists, is that we can do manual therapy at the knee, and that just improves local circulation. But there's a pathway from the knee to the heart and from the heart back to the knee. And so the thing that I would say, if they're practitioners, is take a look at the whole body. I learned that as an osteopath and also as a doctor of oriental medicine. Even with cancer, in Chinese medicine, when we treat cancer, we would say we're not treating cancer, we're treating the human body. Mm-hmm. What does the human body need? Well, the things that we look at is making sure that there's no lines of tension in the legs, the arms, the head, neck, all the transverse diaphragms are open. Your autonomic nervous system, if that's all jacked up because of stress, that affects all your blood flow. So opening these things. So the best advice is always to look at the whole patient. And also, it's more important to know the patient who has the dysfunction than the dysfunction that has the patient. And what I mean by that is, who is your patient? Are they single? Are they married? Are they a widower? Or, do they have kids? Are they happy? Are they doing what they want? Because that all brings itself to the treatment. A lot of times we're too busy looking at, that knee problem or whatever it is, instead of looking at the whole patient and what's happening with them. Because depending on, and you know it in your life, treating cancer patients all those years, that the family unit is so important. Yep. The whole, everything around that. So I would say, take a look at the big picture. Don't funnel in so closely on what they're complaining of. Take a step back and see the story, see what's happening with the individual. Look at the physiology. The role of manual therapy is to create a better environment for healing. What's this environment like? Mm-hmm. How does that part of the body heal? Mm-hmm. That's what I would look at.
That's awesome. That's very well said. That's for sure. We tend to be, from a PTA standpoint, very busy with schedules and going. And sadly, we are in a healthcare system right now that is like, 5 minutes you spend with, in a lot of the physicians with the patient. And, mm-hmm. The patient is like already confused. And then by the time they realize the question was, the physician is already out of the room. So sometimes it's really important to, look at the whole picture, really just kind of beyond what you're seeing in front of your eyes, and that will be much better results with that. How can people find you?
Well, my clinic here is in Sarasota, Florida. It's called Therapeuitc Systems. And on social media, I have a LinkedIn. It's my name, Doctor. You can see my name on the thing there, Kerry D'Ambrogio. So Dr. Kerry D'Ambrogio will be LinkedIn. But my institute is my last name, D'Ambrogio Institute. So we have a Facebook and Instagram and a YouTube. I'm social media. I don't spend a lot of time with it. I count on other people, but I'm learning to do that. I'm learning to come into the modern age and start communicating. So don't expect too much out of my social media.
Don't worry, I was in that same ballgame not long ago. Perfect. And I will put all that information on the description of the podcast, so they can reach out to you. So
okay, thanks.
What would be 3 books that you would recommend, and why?
Well, I mentioned one earlier, mm-hmm. As a Man Thinketh by Viktor Frankl. And he's a psychologist, and he's the one that was in the Holocaust, in Nazi Germany. And he just looked at the human spirit. And he's the one that basically says the people that fared well on all of this were people that had a reason for living. So I always ask myself questions, like at the end of the day, what did I learn today? At the beginning of the day, what do I want to learn, today. I want to, I want to enjoy my life. I want to say, how can I get better today at doing, what I do? So that book has meant a lot to me. There's another book. It's called The Four Agreements. I have it on my phone, and on my phone, the Four Agreements. I think it was be impeccable with your word, always do your best, never assume. Oh, what was that? Yeah, I can't remember. But it's called The Four Agreements. It's four simple things, and the things that we do all the time, or we don't do it. Sometimes people say something or do something, and we assume the worst. It says never assume, always do your best, and be impeccable with your word. Meaning always, your word is be honest with what you're saying. Be true to your word. Don't tell lies and things like that. It's just four simple things. I can't remember the fourth one.
Yeah,
but it's something like that. The other one that I read was by Stephen Covey. It was 7 Habits of Highly Effective People, and he goes through these 7. I remember sharpen the saw. That means always like Tony Robbins stuff, constant, never-ending improvement. And he would always say, listen, seek first to understand before being understood. I remember that. So being a good listener, and start with the end in mind. You would have that. But it was a great book. I mean, it's really timeless, those books.
Awesome. Yeah, that's really good books. I'm here running a list out of this podcast. It's unbelievable.
You guys send me some of those.
Yeah, I have to. It's like, man, I have to then go for like a whole week of vacation just reading books. How about movies?
Let's see. Oh, I have to pick Rocky.
Of course, Rocky. That's a great movie.
When you look at, I mean, I've watched it so many times, and I think it came out in 1977. So I was in high school playing football and that. And what I loved about that book is he had all these gifts, but he came across very humble.
Yep.
And he wasn't somewhat a braggart. I mean, Apollo Creed, he was more of a bragger. But it just shows you what's possible. And it can be for a man or a woman, doesn't matter. But it was all about the human spirit. Is work hard, keep fighting, keep moving forwards. Determination, all these things that I try to pass on to my kids, but also remind myself in your most darkest days, can you keep pushing forwards, constant, never-ending improvement, and, keep that goal in mind. There's another cute book. It was The Magician's Way.
Okay.
And it was about this guy going for a golf lesson, and he hates golf. And this guy, Jim, was his teacher. And he says, all right, take the 7 club out. And he swings it and he hooks it off to the left. And then he slices it. And then he's just getting so upset. And then finally Jim goes, okay, put your club down. That's not working. He goes, pick up the ball. So he picks up the ball and he goes, see that tree over there? I go, yeah. See if you can throw the ball and hit the tree. So he hits it. And he goes, that was really good. He goes, hit that tree over there. Does that. Keeps doing it. And then finally the guy goes, what the hell does this have to do with golf? Then Jim goes, what were you thinking about when you threw the golf ball? And he goes, I wasn't thinking of anything. I was aiming at the tree and I just threw it. And he goes, exactly. He goes, what were you thinking about when you were swinging the golf club? He goes, I was thinking about my stance, my grip, how far back. He goes, forget all that. Put the ball down, get in your stance, aim, swing. And so the whole meaning of the book, it was a great book, is that keep your eye on the target. What's your goal? And it's kind of like the theme we've been talking about. There's going to be bumps along the way. Life happens for you, not to you. And don't worry about that stuff. Keep working through it, but constantly keep your eye on the target. Keep moving forwards. That's awesome. That was a fun little book or movie.
Okay. How about who were your most? I know you've been doing a lot, and I'm sure like going through the world, meeting amazing people, but who would you think were your like main mentors?
I'd have to say, and it's funny, everyone would say, oh, it's your dad, but it's my mom.
Oh, wow.
My mom was a key mentor. She's Irish descent, tough lady. she ruled the roost. And she was, when my parents got divorced, they got back together again, but she had like 3 jobs. And I think I got my work ethic from her. And she never she had cancer too, I
Oh,
forgot about
wow.
that. She had ovarian cancer. And luckily for her, she never read she never went on the internet, so she never know how bad it was. But she was all happy, positive thinker. She had, she did chemo, lost her hair and all that, but she laughed along the way and everything. And she did very well with that whole process. Um, I mentioned one of my patients, Howard. He's 90 years old, and what I love about him is I was during COVID, I was started treating him online, and I do an energy technique, and he was responding well to it. And he goes, "I want to learn that." He's 90 years old and he wants to learn it, and he ended up treating me with it and did a good job with it.
That's awesome.
And he's always continually learning. So I always treat him. We go through stuff, but then he mentors me in a sense. I mean, just his life, and probably that John Warnham, the guy that was 99 years old, is when you listen to him and he still loves what he does and he still gets up every morning. That's going back to Viktor Frankl. He had a mission. He had a purpose in his life. He was moving in a certain direction and he did it. And I remember sitting with him in England. We'd have a cup of tea and he goes, and he would talk about different people. Oh, he's dead, she's dead. Like he was like the last man standing. And I
Uh-huh.
think the thing that kept him alive was his passion,
Yep.
for the work that he did.
Awesome. Is any questions that you wish I'll have asked you and how you will have answered? Is anything to close?
Let's see. You know what? This is something that's been on my mind because I treat patients of different ages, and I'm 60 now. So you're always thinking about, oh, what's your exit plan? Are you going to retire? And you know what? I remember last year I had a couple of weeks off. We visited friends, went to Napa Valley, went sailing and all that. And we had a ball. But I couldn't do that all the time. Again, it goes back to, I want to get back to doing the things that I like to do. And I think that I'm not going to retire. My mentor, 99 years old, he didn't retire. He kept going. And I don't see myself retiring. I want to keep doing what I love to do. And so I still have 40 more years, if I look at it that way, to learn more, to teach more. I got to learn all this internet now, and now AI, right? All the chat GPT and all that. So my mentor Howard, who's 90, and he's still learning. I go, these are my role models.
Uh-huh.
These are the people that I'm not gonna. I'm gonna I'm gonna enjoy myself, go on trips and that, but I'm not gonna stop doing what I'm doing. Why? I enjoy it too much.
Absolutely. And I think that sometimes, it's so great that, that for some reason life kind of have you cross my path or me cross your path, whatever, to our dear friend Lisa.
Yeah.
But it's so great to see like somebody integrating the whole system. Sometimes I still wanted to learn a lot about things that you do that I don't know where, that you do, but definitely just looking at the whole picture. So for our oncology patients, again, it's not just about, like you mentioned, it's not about that you have, ovarian cancer or breast cancer or head and neck cancer. It's like how I can make my body function better. And it's all about quality life. Even if cancer sucks, treatment sucks, you don't feel well, you see patients like, oh my God, what else, But it is a lie on the other side. And the whole idea is just put the best effort and then look people like you or like me that has all this knowledge and value to help you to go to your journey. And then at the end is again improving your quality life. So I really, really appreciate you doing what you do, and you're an amazing clinician. And thank you again for doing this with us.
Well, thank you for having me.
Absolutely. It was great talking to you.
Right. Take care.